Cancer drugs can be life-saving, but there's also a dark side that you need to know about. Hey, Dr. Amy here, and as a cancer researcher, I've seen both sides of Xeloda, the good and the not so good. In this video, I'm breaking down exactly how this chemotherapy drug works, what benefits it offers, and what side effects you need to look for. If you're starting Xeloda, currently on it, or supporting someone who is on Xeloda, well then this video is absolutely for you. Knowing exactly what to expect can make all the difference in tolerating the treatment and protecting your long-term health. Xeloda is one of the most commonly prescribed oral chemotherapy drugs for breast cancer, colon cancer, and sometimes even stomach cancer. Its generic name is capecitabine. It works by interfering with how cancer cells make and repair their DNA. This actually makes it so cancer cells cannot multiply and divide. As a cancer researcher, I've often seen Xeloda used as a type of maintenance chemo after you finish your initial IV chemotherapy treatment. It can help reduce the risk of recurrence by targeting microscopic cancer cells. These cells might be lingering in your body after treatment or surgery. For some cancer survivors, it feels empowering to take this oral medication. You can take it at home on your own time instead of going into a cancer clinic and sitting in an infusion chair for hours. But it's important to understand both the benefits and the challenges before starting it. Xeloda is designed to convert inside your body to an active form of chemotherapy, known as 5-fluorouracil. This is also known as 5-FU. That conversion mostly happens inside the tumor cells. This is part of what makes it so effective. It delivers that cancer-fighting power directly to where it's needed the most. But the side effects vary depending on how your unique body processes the drug. Most cancer survivors take Xeloda 12 hours apart, spaced evenly throughout the day. You should always take it within 30 minutes of eating, and it's usually dosed to take 2 weeks on and 1 week off. That week off allows your healthy cells a chance to recover and repair. One of the cancer survivors I work with inside the Cancer Freedom Program described her week off of Xeloda as her week to recharge. But when she first started her treatment, she didn't know what side effects were normal and which ones should she report. And that's what we're going to make clear for you right here. The most common side effects of Xeloda are fatigue, nausea, and diarrhea. But what can often happen and deserves mentioning is the hand-foot syndrome. We'll get into that more a little bit later. Now, the fatigue, it can be profound. Like not just tired, but exhausted. It can be like this deep down exhaustion. So even climbing up the stairs in your house or folding laundry really wipes you out. Now, I remember during my own stage 3 diagnosis that when I was tired, I thought resting would help. Just have a nap. But that actually makes the tiredness worse. To truly get your energy back while on Xeloda, you need to focus on targeted nutrition and gentle movement, not just sleep. Now, nausea is another common concern. For most people, it's very mild and manageable. Many people don't need any anti-nausea medications at all. But some people find that taking occasional anti-nauseants or even having ginger tea is helpful while they're on Xeloda. Now, if nausea becomes severe and is unmanageable, this is definitely something you need to talk to your team about, because it does not need to be like this. Staying hydrated is also key because being dehydrated can definitely make this worse. Now, diarrhea is one of the most serious side effects to watch for. Xeloda impacts rapidly dividing cells inside your body, and that includes the lining of your digestive tract. If you have more than 4 loose stools per day, or notice any blood in your stools, then you need to report this to your team right away. Because if diarrhea is left untreated, then it can lead to severe dehydration. This can cause problems with your electrolytes and can be really serious. Now, I've seen women be hesitant to report side effects to their team because they don't want to be taken off this type of treatment. But early management of the side effects can actually mean that you're on treatment for longer, or maybe you even have fewer dose reductions. So report it right away. Now, let's talk about hand-foot syndrome. This is something that surprises a lot of survivors. This side effect shows up as redness, cracking, or peeling of your hands and your feet. It might feel like burning or stiffness, soreness, even tingling. In severe cases, the skin could crack and bleed. What's causing this is small amounts of the chemotherapy is actually getting to the small capillaries in your extremities. That's what's causing the damage. But here's what I've learned both from my research and from working with thousands of cancer survivors who have been on Xeloda. Prevention is better than treatment. Keep your hands and feet well moisturized multiple times a day. Avoid tight shoes or tight clothing and limit your hot water exposure. You don't want to dry out your skin. If it becomes painful or you start to lose function in your hands, then this is something you need to report right away. You may just have to take a small break from the treatment and then go back on. There's also a lot of different ointments and creams that are recommended by clinicians and cancer survivors I've worked with. I'm going to link them up below so you can look through. Now, Xeloda can also lower your white blood cell count. This can leave you very vulnerable to infection. Now, your oncologist will monitor your blood work regularly to make sure that your blood work is high enough for you to proceed with treatment. They might also look at liver enzymes and kidney function. But you may also notice changes in your taste, your appetite, or your weight. Some cancer survivors describe like a metallic taste or food aversions. Sometimes this can make eating a little bit challenging. But this is where targeted nutrition makes a huge difference. When I was rebuilding my body after my own treatment, I focused on nutrient density, lean protein, colorful vegetables, and omega-3 fats. Protein is especially important when you're on oral chemotherapy because this is what's going to help your healthy tissues repair and rebuild. Another key piece to this is hydration. Even mild dehydration can worsen the fatigue and the nausea. Aim for at least 2 liters per day. This is your minimum. Now, something else you might not expect is that your skin can become sensitive to sunlight. Xeloda can make you photosensitive. This means that you're quicker to burn or that you have a rash. Use sunscreen, wear protective clothing, and cover up. Now, the dose of Xeloda really depends on what's called your body surface area. This is a calculation done based off your height and your body weight, and that's how we decide your dose. So just like chemotherapy, everyone's dose is unique to them. Now, many cancer survivors wonder if they're going to lose their hair on Xeloda. Now, hair loss is not common. This is not a typical side effect of Xeloda. That can be a huge relief to a lot of cancer survivors who have already lost their hair through cancer treatment. But remember, even though it's oral chemotherapy, it's still a potent drug. You deserve the same level of care and support that you receive during IV chemotherapy. Now, I work with a cancer survivor inside the Cancer Freedom Program. Her name's Robin. Robin was prescribed Xeloda for multiple rounds. Her biggest side effect was hand-foot syndrome, and she had some slight upset in her stomach occasionally. That is it. Overall, this drug is rather well tolerated, so you should feel optimistic heading into your treatment. But of course, it's not like that for everyone, so if you do have side effects, know that we can do something about it. With Robin, we focus on targeted nutrition, making sure she had the right protein, the right electrolytes to support her body throughout the Xeloda treatment. Plus, we use a variety of ointments and lotions on her hands and feet to minimize the hand-foot syndrome and keep her healthy and well. That's the balance with Xeloda, managing the side effects without sacrificing your quality of life. It's a powerful tool in your treatment, but you do need the right lifestyle strategies to make sure the side effects stay away. Adequate rest, targeted movement, hydration, targeted nutrition, they're all going to play a role in how well your body metabolizes the drug and how well you recover. Now, you might be wondering if Xeloda is ever combined with other treatments, other chemos or radiation. And this really does depend on your type of cancer and your unique treatment plan. In some cases, Xeloda is used alongside radiation for rectal cancer. This is because it also makes tumors more sensitive to radiation. But in others, it's used on its own after surgery, or it might be used just as a maintenance chemo after your regular chemo. Now, I think it's important to acknowledge the emotional impact of Xeloda. Swallowing a chemo pill every day can feel like a reminder of your cancer. That's something I deeply understand, both on the personal side and from working with cancer survivors for over 15 years. But I want you to know that feeling this way, it's normal. You're not alone. This does not mean you're weak. You're actively fighting for your future health, one dose at a time. Now, Xeloda is just one piece in the bigger picture of your cancer treatment. There's so much more that survivors and thrivers need to know before they start chemotherapy. If you're about to start treatment or you're already in it, then you need to watch this next video. Click here to watch the 12 things that no one tells you about chemo. Click the video here and I'll see you in there.